As we reported last week, Amarillo's hospitals are being inundated with people coming in with COVID, the flu, and now RSV. In our regional and rural hospitals, they're feeling it too. Tonight, KAMR Local 4's Kaylee Green gets a look at how they're handling the influx of patients.
John Henderson, the president and CEO of the Texas Organization of Rural and Community Hospitals, says it varies by region, but most rural hospitals in Texas are holding up with regard to bed capacity right now.
Of course, they're seeing increased volume of both flu and RSV, but not pushed to the absolute limit the way we're seeing in some of the children's hospitals and more urban hospitals.
Jeff Barnhart, the CEO of the Duff Smith County Hospital District, says they've seen a big wave recently, with COVID, the flu, RSV, and even strep keeping them extremely busy.
This last weekend, our clinic in 2 days saw 70-something patients. Our ER has been stacking up. We're full. We can't see any more in our clinic, so that volume is moving over to our ER.
Some of that inundation in the ER becomes a staffing issue, and rural hospitals generally have had trouble not just with nurses and doctors, but respiratory therapists, and all that becomes important.
Barnhart says bed availability is fine, but with many staff members out sick, they've gone back to masking for employees.
At the end of the day, if you're sick, stay home. Don't go to school. Don't go to work. You're just spreading it when you do that.
To the extent you can, try to be safe, wash your hands, try to keep the load and the transmission off of these rural hospital ERs to the extent that you can. Don't get sick. It's really as simple as that.
Barnhart says they haven't had to transfer patients to other hospitals in the last few days, but last weekend it was a real problem. He said they had 3 pediatric patients who needed to be transferred to larger facilities in Amarillo, Lubbock, and others were all full and very busy. Live in studio, Kaylee Green, KAMR Local 4 News. Jackie.
Kaylee, thank you. Barnhart tells us they're starting to see shortages of drugs they routinely use to treat patients. He's encouraging everyone to get vaccinated if you haven't and to take precautions from getting sick.